Yeah.
What made you want to be an oncologist?
So I wanted to be an oncologist because I was interested in science and math and the biology of how our bodies work and all that kind of stuff. And so I um, decided to go into medicine, and then in medical school and doing rotations, I learned that I kind of enjoyed the science of oncology because it involved people of all ages, and it was a specialty that dealt with so many different aspects of, of the human body, from not only taking care of the cancer itself, but the way that the treatment may affect the heart, the lungs, kidneys, involvement in infectious diseases, and I just liked that kind of comprehensive medicine.
What process did you have to go through to get to where you are today?
In terms of being an oncologist, like the training
Yes.
related to that. So after finishing, 4 years of college, of undergraduate studies, I studied microbiology, although, you could do just about anything. Then I went to medical school. Medical school is 4 years long. The first 2 years are mostly concentrating on book learning, and then the next 2 years are mostly involved in working in the hospital and working with patients. After finishing my medical degree, I did an internship in internal medicine, and then finished my residency with 2 additional years of residency in internal medicine. And really those 3 years are all about working in a hospital, taking care of patients, under the sort of supervision of older residents and physicians who have completed all of their training. And then to specialize in oncology, I then went into a fellowship training program, which was 3 years of really just focusing on the patients with cancer and blood disorders. So after my fellowship, 3 years of fellowship, then I was completely trained in my field, and then I was eligible to take the board exams for medical oncology and hematology.
What makes this job difficult?
I think probably the most difficult thing about medicine in general is, helping patients with very personal, intimate needs, and all the uncertainties around that. So I think sometimes many people think, the typical thing people go to see their doctor about might be, a cough or a cold, and fortunately most people will recover from that. In helping patients with cancer, there are so many uncertainties in terms of how effective the treatment may be, the chance of the cancer coming back. So I think that makes it difficult, kind of helping people adjust to what it means to have a diagnosis, that there's not a lot of absolute guarantees that they'll get better, or dealing with all the uncertainties of what the treatment may be for them in the long term.
After more than 20 years in this field, I imagine that it's still hard losing a patient, but how do you cope with that?
There's so many, every person that dies related to their cancer is different, and probably the best ways to cope with it is to help the patients in preparing. A lot of times we have an idea ahead of time that the patient is going to die because of their cancer, so I think it helps to talk to the patient and their family before passing about what that's like. It helps to talk to people that I work with, but really every case is different, and as sad as some cases are, in a weird way, sometimes a death can be seen as a natural, and sometimes even a good thing, depending on what the patient's condition is, or what their life has been like and what I guess what they've gone through.
What kind of advice do you give to families of the cancer patients?
So I think a lot of the advice is around encouraging patients to talk with their families about what it's like to have the cancer or go through the treatment, and talking a lot about how they're feeling about their particular situation, encouraging them to focus on the symptoms that the patient is having and not so much on things that they can't control. So I think a lot of advice is around helping patients with a focus on things that we can do to help, and try not to focus on the things that we can't change.
From what you have seen through these years of experience, what do you see patients go through emotionally, mentally, and physically?
Well, it's just a wide spectrum of every emotion, from happiness to sadness, a wide spectrum of physical effects, from being in great health and getting back to exercise to dying. I guess that's the other end of the spectrum. What was the other one? Emotional, physical, and mentally. Yeah, again, that whole spectrum. Some people are so excited when their treatment is over and they're in remission and they're excited about getting back to life. And then the other end of that spectrum is sometimes the sadness or the pain that goes with the treatment or losing a loved one and things like that. So it's a pretty wide spectrum.
What do you believe a person must bring with them into this field?
Well, so I'd like to think that you have to have a lot of compassion for people, and I'd like to think that you have to be a good problem solver and critical thinker. I think those are two important qualities.
Well, thank you for taking time to do this short interview, Dr. Lucero. You can cut now.